is non-neoplastic interlayer lesion that mimics brain tumor or multi-parametric MRI. There can be infectious lesions that are brain abscess, tuberculoma, neurocystic sarcosis, brain abscess. In this MRI imaging, we can see the T1 weighted image shows the hypointense center, while T2 weighted axial image shows hyperintense center with hypointense capsule. Diffusion weighted image is more important that we compare it with ADC. We can see the significant diffusion testing that is key picture. And post contrast axial image, we can see the ring enhancement. Abscess is usually used to differentiate it from the tumor, but the tumor has irregular thick core and no diffusion restriction. Tuberculoma may occur in a brain region but tend to occur more often in supratentorial region. In this MRI image, you can see the tumor core is iso-intense to the gray matter, while T2 weighted image we can show that it is hyperintense with hyperintense ring. On diffusion weighted imaging, we can see the no evidence of central diffusion restriction, and on post contrast weighted image you can see the ring enhancement. In non-gazetting granuloma, entire lesion is T1 and T2 hypointense with homogeneous enhancement. It can mimic the glioblastoma multiforme or Nites. Glioblastoma multiforme is a thick irregular ring which has bi-rough perfusion and high conformed within neurocystic sarcosis. MRI image we can see the sagittal T1 weighted image core is hypointense to the gray matter. If the skull axis is present, we diagnostically T2 weighted axial image show the hyperintense lesion with surrounding lesion edema. Diffusion weighted image is no evidence of diffusion restriction. Contrast image show ring enhancement. Neurocystic sarcosis mimics the glioblastoma multiforme and METs. The eccentric collages are more present for the neurocystic sarcosis, and it resolves or changes with follow while the tumor factor imagination. MR imaging is also the T1 weighted axial image shows the lesion hypointense to gray matter. T2 weighted image shows the lesion hyperintense. Diffusion weighted image shows slight diffusion restriction, and post contrast imaging is incomplete ring enhancement. It mimics the high grade glioma. So high grade glioma have thick irregular enhancement, high perfusion and more mass effect, while T1 factor imagination has omit ring enhancement and less mass effect. Vascular lesion, subacute impact and cranial. A subacute impact MRI imaging can see the T2 weighted axial image lesion is heterogeneously hyperintense to the gray matter. Flare image is so the lesion is also hyperintense. T1 weighted imaging is so the hyperintense lesion with central hyperintensity. Diffusion weighted image is so the diffusion restriction, and while post contrast image you can just show the subcutaneous irregular enhancement. It can mimic the glioma. The glioma is irregular enhancing infiltrating mass with high perfusion. Keratoma is a typical popcorn calcification on T1 weighted imaging, and T2 weighted axial image shows signal intensity with perical hypointensity. Diffusion weighted imaging we can see the evidence of diffusion restriction, while the post contrast image shows no enhancement on. Susceptible to weighted imaging we can see the lumen. Keratoma can mimics the hemorrhagic tumor. The hemorrhagic tumor shows irregular enhancement, significant edema and hyperfusion. Inflammatory lesion, neurosarcoidosis and autoimmune encephalitis. MR imaging in this patient we will see the T1 weighted axial image lesion is iso-intense, the T2 weighted lesion is hypointense, no evidence of any significant diffusion restriction, and post contrast image will show nodular leptomeningeal enhancement. It can mimic the lymphoma, but lymphoma no leptomeningeal and cranial involvement and diffusion restriction should be present. While neurosarcoidosis no evidence of diffusion restriction and leptomeningeal enhancement and cranial involvement is seen. Autoimmune encephalitis. We will see the flare weighted axial image. We can see the hyperintensity in limbic system, both medial temporal lobe, but no evidence of any significant mass effect is seen. It mimics the lymphoma mass effect, and it is seen with increased perfusion. Radiation necrosis. We can see the T1 weighted lesion is hypointense on right temporal lobe and iso-intense on left temporal lobe, while the T2 weighted both lesions are hyperintense on flare. The lesion is hyperintense on left side and hypointense on the right side. Post contrast image is so coral image can show the subtle ring enhancement. It can mimic the tumor recurrence. So tumor necrosis show thick irregular enhancement, high perfusion and high colony conformity. Miscellaneous. Resolving hematoma and encephalomalacia. So, resolving hematoma, MR imaging is so the tumor-weighted lesion is iso-intense with hypointense link to two-weighted lesion is slightly hyperintense with lesional edema. Clearly-weighted lesion is hyperintense with hypointense rims. Susceptibility-weighted imaging, you can see the luminally present and post-contrast tumor-weighted imaging is sono enhancement. It can mimic the glioblastoma and metastasis. Glioblastoma is typical location cortical or subcortical region and high perfusion, while intracerebral ambulation is typical location like basal ganglia, thalamus and no post-contrast enhancement. Encephalomalacia, during which MR imaging visual lesion has a CSF intensity, T1-weighted hyperintense, T2-weighted hyperintense, no evidence of very significant diffusion restriction variant, and no evidence of any post-contrast enhancement. It can mimic low-grade glioma. Low-grade glioma have no expected dilatation of adjacent ventricle and no vending loss. Summary. We can use some feature like diffusion-weighted imaging. If there is abscess, if so diffusion restriction, tumor resolution, not central diffusion restriction, we can use spectroscopy. If lipid or lactate peak is present, then it is infection or necrosis. If high choline peak, then it is tumor. For perfusion, if tumor may have high perfusion pressure, non-neoplastic, and low perfusion, susceptibility weighted imaging is useful to differentiate hemorrhage and cavernoma by blooming enhancement pattern. If open ring enhancement is seen in demyelination, smooth thin ring is seen in abscess, irregular thick ring is seen in tumor. Some specialty like Colex is seen in neurocystic sarcosis, gyriform enhancement is seen in infarct, volumulus is seen in encephalomalacia, and retromeningeal enhancement is seen in neurosarcoidosis. These are my reference. Thank you.